A very good morning, everyone. This is Dr. Swasti SARKAR from RIO Kolkata, and today I will be presenting novel spacer filamentous knitted polyester fabric effective in lid retraction correction in thyroid eye disease. Quite obvious to say, I have no financial interest whatsoever. So as we all know, in thyroid eye disease, orbit is the second most targeted organ, where females are the more commoner victims. In this chronic inflammatory disease, lid retraction is one of the most common findings. Just imagine what pain we go through, even if a pimple pops out on our faces psychologically. We hide our faces like that. So just imagine for a second what those patients go through psychologically with lid retraction. And we must not forget about the grave consequences of exposure keratopathy associated with this disease. The aim of our study is to evaluate the functional and the cosmetic outcomes of upper and lower eyelid retraction by using this wonder novel filamentous knitted polyester fabric material as our spacer, and also to appreciate the safety, efficacy, and the durability of this spacer material. In this study, we included all patients having thyroid eye disease, having a proptosis of less than 22 millimeters, and the patients were selected in the euthyroid condition. The patients were all in the inactive stage of the disease, and the patients with a proptosis of more than 22 millimeters having the active thyroid eye disorders and with associated systemic skin disorders like Stevens-Johnson syndrome were excluded from our study. We evaluated and compared the pre and the post-operative values of MRD1, MRD2, the LPS, and the PFH in millimeters. We also evaluated and compared the pre and the post-operative photographs that we took in this course. And above all, we kept patient satisfaction. So as we are using this novel spacer material, we must be acquainted with how much to use, the measurement of it. So the formula for the upper and the lower lid are a bit different. For the upper lid, the maximum central width of the spacer material used was 5 millimeters plus the scleral show in millimeters plus an extra of 3 millimeters. From where does this 5 millimeter come from? Our aim is to induce moderate doses, and normally the eyelid, upper eyelid covers 2 millimeter of the cornea from the limbus, that is 3 plus 2, 5. For the lower lid, the maximum central width used was a constant of 6 to 7 millimeters. For both the lids, the shape of the spacer material used was semi-luna, and the length for the upper eyelid was 26 to 28 millimeters, while it was 20 to 22 millimeters for the lower lid. Now coming to the most important part, the results and the observation. While the preoperative MRD1 value was a whopping of 7.63 millimeters, it came down to 4.68 millimeters postoperatively. The MRD2 value dropped down to 5.2 millimeters postoperatively, while preoperatively it was 6.37 millimeters. Just imagine. The preoperative PFH value was 14 millimeters, while postoperatively it came down to 9.88 millimeters. The preoperative LPS action was seen to be 19 millimeters, while postoperatively it dropped down to 15.66 millimeters. The postoperative scleral show became nil, and the preoperative mean scleral show in the lower lid was 3.14 millimeters, while postoperatively it came down to almost normal 0.21 millimeters. This is a small video which I'll be showing a bit later. Various spacer materials have been used to correct lid retraction, example autogenous fascia lata, banked sclera, septum. While banked sclera is a lot difficult to process and to handle, the novel spacer material is a lot easier to use. This spacer material causes not only the lengthening of the lid, but also prevents the reattachment of LPS and the inferior retractor to the tarsal plate. It has a minimum thickness of about 0.6 millimeters. So I'll conclude my study by saying that this novel material is inert, non-reacting, tissue-friendly material, so no question of graft failure. As it has a very minimum thickness of 0.6 millimeters, it is flexible, the lid thickness and the architecture and the contour of the lid are very well maintained. Thus, the FKPF is an ideal spacer material for lower and the upper eyelid retraction correction in TED. This is a video that I'll be showing. are using the anterior skin approach, placing the material, suturing it with Vicryl sutures. This is how we prepare the material. And recently we have made some developments, that is we induce some holes in the material so as to prepare the material better, and it helps in easier vascularity post-operatively. In lower lid, we use the internal skin approach over here. We are suturing the material. So where did this idea for the material come from? I have a few cardiologist friends of mine. I once heard them using this material in ASD, VSD. We all have studied all these in our MBBS times. So they used to fix the holes by these patches. So I thought, why not try these material in, as a spacer, as a novel spacer in eyelid also.
Right. So what was the major cause in your cases, the etiology?
The thyroid eye disorder.
Thyroid eye disease, yes. Right. How many cases have you done?
30 cases till now.
Right. And how long is the follow-up?
So we have followed up the patients in 1 week, 1 month, and 3 months. It is a long study. We are still continuing the follow-up of the patients.
And the major complication you are having after this?
So among the 30 patients, only 1 patient had extrusion, partial extrusion of the material. Right. We believe that we actually operated the patient in the active stage of the disease. Right. Maybe that is the reason. We'll follow up the patients in the long term.
No other problem as such?
No, sir.
Thank you so much.
Thank you, sir.
Nice idea.